Welcome to NC Political Tea, the show where North Carolina's political scene gets served piping hot, grassroots style. We're here to shake up the status quo with unapologetically conservative takes and a whole lot of Southern charm. From the halls of Congress to under the dome, we're exposing the deals, the drama, and the dirt that the mainstream media won't touch. Who's fighting for your freedom? Who's selling out to the woke mob? And who's about to get roasted? No fluff, no filters, and absolutely no time for spineless politics. Just bold Republican commentary, sharp analysis, and enough sass to make the left squirm. So grab your sweet tea or something stronger, and let's dive into the hottest headlines and juiciest scandals rocking the Tar Heel state. This is NC Political Tea, where the truth always gets served.
It's going to get served tonight. Hello.
It's going to get served every night, but tonight's going to be a really good show. I hope people stick around because we've got some really good guests coming up. But Snowmageddon's coming. You got your milk and eggs and all that stuff?
No. I because I've done that maybe once.
It doesn't happen.
I lived in Boston and New York. So
that's right. I went to CPAC with you, and you don't mind walking in the snow.
No, I'm good. We're good. I've got my Skittles tea again. I keep telling you guys, it's not moonshine. It is Skittles water. We have a doctor coming on later this a Maha doctor. He's not going to like this, so I'm glad I'm doing this before we're on. But we got a couple of follow-up stories. When this deals with kids, this is where we get very serious. Our friend from NC Beat, Gerald, I'm using his graphic.
We love him. We love Gerald. Follow him on X. I try to retweet his stuff. He puts great stuff out, especially on the East Coast of North Carolina.
He's great. NC Beat. He's on Facebook and X. But look, we've done this story for a while. Here's what happened. Late in 2024, there's a school called Inlow Elementary School. This is absolutely horrific. A report emerged in November. A staff member anonymously slipped a photo of a 6-year-old girl with autism. Listen, tied to a chair with a jump rope.
Really?
And both educators in the room, who were in the room at that time, resigned, but it goes on and on. The 3 people you just saw were administrators, because get this. So district administrators, in Durham, were indicted today, or yesterday actually, including the principal of Enum Valley School, 2 central office leaders. Get this, indicted for criminal charges, obstruction of justice and perjury, tied to how they handled this investigation with communications and law enforcement.
Wow. So, you know what? When teachers and administrators lie about what happens to children, you really have to stop and think, what is going on in Durham? Not to mention, we've already seen some really bad things, and we know they'll lie there. We know. They put it on camera.
Is it wrong that I'm actually pleased that someone was finally arrested?
No.
In other words, how many times does this go on? And, I believe that teachers want to do the right thing. I really do. I think, and by the way, this is what happened. Good-natured teachers saw what happened and reported it.
I think it's always Sloan, we always talk about the 80-20 rule. In teaching, I usually think it's a 90-10. However, since COVID, it makes you question everything.
Well, it's probably good that you do, because we're seeing a lot of very dangerous nonsense go on in the schools, and aided and abetted, of course, by far left outfits, namely NCAE. So this is what they're doing. We don't have a teachers union technically in North Carolina. This is not a teachers union. It is an organization, right? But the NCAE, and they are a partner of the National Teachers Union. Check this out. On Friday, they want all the teachers in North Carolina to wear blue to protest law enforcement, to protest ICE doing their job. And by the way, because I'm very angry, when we talk about this next story, you will see the need for ICE to function in our communities.
But I
Crazy.
do want to say something. You never see teachers say wear red on Fridays for all the heroes and veterans, but they will wear blue to try and make a statement. And let me just say this to you, teachers. I will ask everybody tomorrow who's in carpool, who's going to drop their kid off, whatever they're doing, to tell me which teachers have blue on. And I hope it's an accident, because you might just get a picture taken and you may be seen on camera.
You might be on our show as an uninvited guest. But look, this group is
your outfit. And look at me, Miss Sweatshirt.
Y'all better bring it. Y'all better look good. So look, this is just what the public schools have been doing. Wake County, which is the biggest county in North Carolina, a couple of months ago, they sent something out that said, we are not going to cooperate with ICE. Yes, you are. This is federal law. So yes, you are.
Just a trivial piece of information. There are now more homeschooled children in North Carolina than all the population of the schools in Wake County.
161,742 students.
People they're not putting up with it anymore. They don't want this stuff.
Right. And this is why. I mean, this is more bullcrap they've done. They're teaching, right, that they're going around and doing what's called professional development. I want you to know what they call it, guys. It embeds CRT, which teaches our children that because of their skin color, they are less than. DEI, same premise. Christianity is bad. Being straight is bad. And don't tell us they don't do it, because I've spent 5 years as an education reporter showing you that they do. Here's one. They actually banned, they got all the teachers together. And by the way, I think 10% of teachers participate. They actually made a big brouhaha about passing the anti-DEI bill because they wanted to keep treating Black children like they are less than white children, and that they would forever be oppressed.
Victims.
Which is
always victims and oppressed. The other piece of it that we didn't talk about is social emotional learning, which is all underneath that. And the things that, like, I'm thinking about now, I don't know if you've ever seen these books that they think we want to ban, but I think are inappropriate. They always want to make you feel bad for somebody that is in your classroom that you never met because they're not there. About, their dad got deported or they're in prison. Like, I'm sorry, you're an illegal if you got deported, and if you're in prison, you're a criminal. But we're supposed to feel bad. Now, listen, I don't think kids should take the burden of their parents and what their parents do. But also, I don't think it's I don't think it's a kid's business to know what adults are going through in those situations. I think I grew up in the era where we shielded children from that. We didn't want them to get involved in the emotional.
If everyone is equal, then why are you bringing their maladies into the forefront of the educational experience?
Right. Absolutely agree.
And this one, we can't forget this. This is a classic.
That was during COVID. I remember that one like it was yesterday.
But it is yesterday, because
it's
yesterday
still going on.
That's right. So their political movement is, and you can see this, flip the General Assembly. So this is a group that masquerades as an educational group, right? We are for teachers, we're for parents, you're for political operations only. And I just proved it to you by showing that.
Well, and you know what's funny? Like what I've heard from teachers up here, because listen, nobody pays dues for anything if they don't have to, because they don't have enough money to do anything anyway. But they always get pressured. Like if they're not a part of that group, they get pressured at school. And I'm like, that's against the law. You need to report it. But if we report it, we get in more trouble. More trouble. True. How? Harassed?
Well,
many harass somebody in a right to work state if they don't join a union.
Well, many do. I mean, that's true. So we don't have unions here. And the funny thing is they call themselves a union. But that's not accurate. But what they are is a political group, and they try to encourage teachers to be political instead of caring about children. Hell, we saw that during COVID, where they demanded the schools be perpetually locked. In fact, the NCAE said that white supremacy is why schools are opening. I'm not kidding you.
So I personally think it might behoove us to have Mr. Farley, our labor commissioner, take a look at whether they try to act like a union when they're not.
Yeah, that might be something that we can do. It's purely political. But the education of our children is serious. What you just said is true. North Carolina is the largest state for homeschooling. And now we see why. That's not available to every family, but you can see what necessitates it right in front of your eyes here.
Right. I do want, maybe going forward, Sloan, I know we don't have time tonight, but we need to talk about how homeschooling is held accountable by the state, how they fund, how they test, all that. But we can do that on another show, because I think it's important people understand they're not held under Mo Green.
Oh yeah, definitely not. Completely separate entity, etc. And very little rules, because government ain't in charge.
Because we like it that way.
That's right. So we have an update on this situation. Whoops, let me remove this. We have an update that's not good. We're just moving people around. Okay. This young couple that was killed by a drunk driver. I mean,
I'm still mad.
I'm still very upset. And so a drunk driver smashed into these two. And now we're learning that he had been arrested in Cabarrus County in 2020 for drunk driving also.
And he should have had a detainer.
So this is Cabarrus County Sheriff Shaw. Okay, Republican. He does not have an opponent. During that time, 2020, he was a sheriff. He came into being a sheriff in 2018. And I checked. So in 2016, the county signed an MOU with ICE. So they agreed to cooperate from at least 2016. And the way it works is the jail would have a suspicion that someone's an illegal and call ICE, and then ICE would issue a detainer. So let me tell you how the system failed.
Just one second. MOU, Memorandum of Understanding, right? A partnership.
Yeah.
Yeah. Just want to make sure everyone understands what that is.
Thank you. And in 2020, remember, Trump was president then. So he was a strong proponent of that. So this son of a bitch, criminal. Now, I'm not you, Sheriff. The criminal that killed these two young people was arrested in 2020 and for some reason was allowed to walk. So let me finish the story. So it failed at the jail. The jail should have called ICE. Did they call ICE and we don't know? Not likely, but maybe. But he would have been out of the country. Okay. If ICE
would have been back under Biden.
Well, maybe, but he would have at least been out and had to get back in. So Here's where it failed. The DA dismissed the charges. Let me tell you
was there a drunk driving charge for that too?
No, this is the 2020 charge. Let's just stick with the 2020.
Was that drunk driving too?
Yes.
Okay.
Same charge. Okay. So the DA dismissed it. Now, if the DA would have pressed the case, that would have been a stronger impetus for ICE to come and take him out of the country.
Right.
So it failed at two different levels. And so this is important right now. This is critical. The law that the General Assembly passed, remember, with one override of a veto, one Democrat vote. Look at this law. Any illegal that has a DUI, okay, out of here. So not only is it at the federal level, it's at the state level. This is what Josh Stein vetoed, ladies and gentlemen.
Well, and it's not just that he would veto it, Sloan. He will emphasize that this guy needs help. He doesn't need to go to jail. He needs mental help and he needs alcohol. And I'm not saying he doesn't, but he can get that in jail.
Well, he can get the hell out of our country.
That's right.
So I want you to know, Republicans this session passed this law that says you're not allowed to get out of jail. You're illegal and you have a DUI, because believe it or not, that was not codified into law, which is incredible because that's how a lot of people die. right?
Right.
And I read all of our comments on Facebook today, and I had a couple of leftists that were very cute, and they wanted to come on and say, well, Americans kill people and DUIs all the time. That's true, and it's unfortunate. But if not for this son of a bitch being in this country, okay, these two, let me remove this, okay, these two would be alive.
Fletcher,
I'm talking about this particular crime, and we have others like them every day all across this country.
You're right. You're absolutely right. And here's the thing. I don't care whether it happened before or not. The fact is it continues to happen, and it shouldn't.
Well, yeah, absolutely. And now, again, the Democrats are against, okay, keeping an illegal in jail and in an ICE retainer. They're a detainer. They're against that. I want you to know
they're pro-crime. And I think if you're not paying attention to what's going on in Virginia right now, these people ran as moderates, and they're like overrunning the state. They're making laws. It's insane. It's insane. And that is what is going to happen in North Carolina if we are not careful.
Well, I do want to give a shout out to this DA. This DA was appointed and brought in 2022. The other DA was abysmal and had a long-standing history of letting DUI people walk. A long-standing history. I talked to Representative Brian Echevarria today that says, and he was very clear about this, because of Ashley Shanley, you do not want to be arrested and prosecuted in Cabarrus County.
Well, that's the way it should be. That's the way it should be.
That's the way it should be. And again, I want to bring this up before we bring a special guest up, Frank Sossaman. The Democrats are on record. In fact, they're a one-note Sonata here in North Carolina. They believe that repeat violent crime is a mental health issue. They've said it.
Josh Stein says it all the time. Listen, let's go back to Christmas. He had people that are felons, criminals, their ornaments on his tree, and he was all excited about that. But what about the victims? What about the victims of all those crimes? Why not have their ornaments on the tree? No, we got to have criminals' ornaments on the tree. That's how they parade them on every angle they can.
Love the criminals, and the more violent, the better. In fact,
absolutely,
the murderers, he said, DeCarlos Brown Jr. should not be in jail. The man who killed the teacher here in Raleigh broke into her house and beat her to death while she was on the phone with a 911 call. He said he didn't belong in jail. He actually said that.
I know.
So
I don't know how we wake North Carolinians up that don't normally watch the news. You know what I mean? We have people that, and listen, a lot of people work 2-3 jobs just to be able to feed their families and, take care of themselves. And we've got to get to a point where these people know, because elections are coming and they have consequences, and we're watching them play out in our own house down in Raleigh, specifically with Josh Stein, because he vetoes everything. But we're also watching, and predictably, what our future will look like if the Democrats take the House in North Carolina.
Well, we already know when they vetoed a bill that would have saved the lives, if that were followed in 2020, of these 2 young people. So look, we've talked a lot about the connection with violence and mental health. We're not denying that, mental health is a contributing factor to violent crime, but we're going to have an opportunity to talk to someone who actually knows. Frank Sossaman, he represents Vance and Granville County. He's in District 32, which is Vance, Granville. The interesting thing is he was elected in 2022. That was the first time that a Republican went to the General Assembly from that district. He lost by a very slim margin. Okay. And
51 votes. It was like 51 votes. It was crazy.
It's ridiculous to a Democrat. He's running again, but not only is he a pastor, but he has a lot of experience with this. So, Frank, welcome on the show.
Thank you. Good to be with you.
It's good to finally meet you, Frank. I've been touting about how important your district is for a long, long time, and how important it is that we win 3 out of 4 contested races. Yeah. Are you in a contest there?
I am. I have a primary. This is my first time having a primary. I have a Democrat that switched to Republican, which is part of the teachers union. So I have that taking place.
So you're facing up with two Democrats.
Yeah, actually, that's reality, which is, in my opinion, it's unethical. It slaps the voting system right in the face, which is sad. But that's their strategy to raise the awareness of teachers and teacher pay. 60% of the state budget goes to education. 40% takes care of the rest. DOT, public safety, prisons, those kind of things. I don't know how that anybody would expect us to give the teachers the education 70% or 80% of the budget. Then there'd be nothing else to run the government. So, but anyway, that's their strategy, and I think I think there are other ways to do it, because it's deceptive to say that you're one thing when you're really something else. If by chance this person would get elected, they would not represent Republican values.
They're not going to be elected. They're a trans Republican, and we'll make sure that people know that. But
I think the other piece about that is we will be doing many, many more shows on the people that, because we have them all the way up here in Western North Carolina. They're all over the state. Yeah. We know who they are. But to deceive people just because you're trying to make a point, the part that bothers me, Frank, is the NCGOP needs to do something. They need to do something legislatively that says, hey, look, you can't get on a ballot if you've not been a Republican for more than X. And it's not 90 days.
Well, the plan of organization for the Republican Party in the state says you have to be a Republican for a year.
That's right.
So we don't even acknowledge.
Where's Jason Simmons?
That's right.
Yeah, I'm not sure.
Right.
Do you actually know who Jason Simmons is? Because a lot of people in the party don't, because they haven't met him yet. I mean,
well, so not from North Carolina. That's why.
Well, look, that has burned me up to the core, because we've got a woman who pledges her allegiance to ISIS. She said that, and she's dressed in a burqa, who is masquerading as a Republican. It is a great shame to everybody. I cannot tell you the amount of phone calls I get weekly, and all I can say, weak county leadership, which I know the county leadership there, it's hard for me to say that, and weak state leadership, because I would call a press conference that day and say, no, we're going to contest this.
I agree.
But anyway, we're having you on because, look, we've got the serious problem of mental health, which is very serious. And it's a shame that to reduce the seriousness of it, the Democrats have said, oh, violent criminals and mental illness go hand in hand. That is a degradation of the mentally ill, quite frankly. And it's letting real criminals off the hook. What are your solutions, and what do you think?
Well, when I was in the House, I worked on a bill called Faith in Mental Health. I worked on that bill with the health department for Granville and Vance, for the mental health provider, which is VIA, and also I worked with the Health and Human Services mental health division in the state. We all worked collectively to develop a program that would allow churches to have the opportunity to become aware of there's 3 levels in the program. The first level is going through an orientation to learn about all the providers in the county. So the church then could help its members and community members navigate in this arena. Whenever we closed down the brick and mortar building and subcontracted all the services, people have been lost ever since, because they don't know where to go. And if they know the name of an agency, they don't know where it's at, because a lot of those aren't identified in the community. So anyway, but the orientation they go through in level 1 gives them that information, the name of the agency, what the agency provides, the services, where it's at, how to make a contact. And that is invaluable information. And then the second thing they agree to do in level 1 certification is to highlight a mental health issue each month. And what that does, it begins to remove the stigma of mental health. Now we can start talking about mental health, because in most cases in the community and in the church, we don't talk intelligently about it. People have their stereotypes. So, but it really,
they view it as sin, probably.
No,
and nobody wants to sin.
Some do. Yeah, some do.
I think it's a little different. I think Southern culture, everybody has a crazy aunt or uncle. God, God rest their soul. But that they treat them that way, instead of saying this person has bipolar disorder or this person has schizophrenia, it's the crazy uncle or the crazy aunt.
Mm-hmm.
Well, we're having people that are stabbing people like Irina Zaruska, DeCarlo Brown Jr.
Yeah,
has been called a schizophrenic, and we should give him a break. Now, I'll tell you that I've seen his intake papers from the last 4 years. He's got marijuana and cocaine in his urine. As you're probably aware, that can produce schizophrenic type presentation, right? So the guy's a drug addict and a dirtbag, but he's being called, right? You know what I mean? And this is a huge problem.
Here's my question. At what point are we going to open Dorothea Dix back open and really put them in a place where they belong? I mean, we used to have, we still have Broughton. I don't know if Broughton's still around or not. It might still be, but Dorothea Dix used to be the one mental place where everybody was put in one community with all the resources right there to help them. What happened to that, Frank?
Well, the whole idea of mainstreaming people with mental illness back to the community and receiving the services they need in the community was an idea that happened in the 70s, and we are paying the consequences from that now. Because number one, we don't have adequate services. We have some, but not adequate. And then there are some people that need to be in a facility. They're not able to live in an unstructured society. They need to be in a structured environment. And to me, to make excuses with some of these individuals who have mental illness, and then some of them are just absolutely mean, we've got to deal with that. And we cannot allow these people to leave and run free without being properly assessed. I mean, because a lot of these murders could have been prevented if we would have taken the correct answer. But what I have discovered, people that have mental illness have more rights than the public. And what happens is that they victimize communities, and it is our fault because we're not properly processing them and giving them the services they need. We're just turning them loose.
And giving them a lot of drugs.
Yeah.
I mean, I think Sloan, who's been in the medical industry, will attest to the fact that since the 70s, I would say since the 90s, we've escalated the drug usage for specific ailments that in the past nobody ever had. Yeah, SSRIs and their antidepressants and anti-anxiety medications.
Maybe. I mean, there's no doubt. And by the way, wrapping up here, Frank, that's one of the things that I want you to hammer your primary opponent with. A couple things. First of all, the complete lack of discipline in schools. It creates a condition by where young people feel like there's no consequences. And I got to tell you, I don't care if they're white or black, or if they're driving Mercedes around, or a beat up Hyundai. It's that lawlessness and entitlement. That's one. And the second thing is getting all these mental health providers in the schools. Well, there's overdiagnoses, especially when they're being incentivized. Now, Brian Echevarria out of Cabarrus County, to his extreme credit, he's just been pointing that out, right? We talked about this, in the 90s when they were giving out Ritalin like candy?
Yeah.
And here we are again. And so, I think you can hammer your opponent with that for sure, because she might be part of the problem. She's with NCAE. She is part of the problem.
Oh yeah. She
wants those students to run wild.
That's true. Our moral compass is out of whack as a society too.
Yeah, it totally is.
Yeah. So there's no absolutes. And of course, from from a pastoral perspective, I think that's because we've gotten far away from the Bible.
Yep.
When I was growing up, I never asked the question, am I a boy or girl? I didn't ask that question because I knew, the Bible created Adam and Eve, and that the scripture says
God doesn't make mistakes.
That's right. So, but now because we moved away from the Bible, we don't have those absolutes in our system, in our heart, in our life, and as a result of that, we stray away and do unbelievable things. I mean, we have crime that's committed that is beyond understanding how humans can treat each other the way. I mean, we're not talking about just killing people. We're talking about cutting people up. It takes people that have lost all sense of direction and values to do something like that. And it's the people that are in their right mind that have to address that in a reasonable way. We're not talking about locking everybody up, but we are talking about properly assessing the person's mental aptitude and then giving them the services they need. Yes, sometimes that means they need to be locked up in a facility because they're a danger to themselves and a danger to society. But we're not doing that. We're real lenient on all that.
So listen, we have very little time left, but I want to give you a second. What are you running on? What's your platform?
Well, I'm running as I have before on education. It's critical in our area, and I was on the education committee, so I'm a strong advocate of education. I serve as the president of Crime Stoppers in Granville County, and I served also in Vance, and I served on the state board. So I'm an advocate of public safety. I'm working aggressively on that. I'm economic development as well. I was able to bring millions of dollars back to the district for economic development, and for over 45 million all total for projects, and some of those projects were economic development projects. So agriculture is a priority of mine because we are an agricultural area, plus many other areas that I have focused on. I mean, I did forums when I was in the House, broadband, to educate and inform people of what's going on, what can they expect. I did forums on daycare and the crisis that we're in with our daycares. I did forums on mental health.
I saw you at my education forum.
Yes. So I mean, I had a long list of forums to educate my district.
Great.
And inform them. And
people like it.
I'm an active person in the community. I started a litter campaign in Vance County and in Granville County that's going very well. Got a lot of partnerships. So just because I didn't win the election the last time, I didn't stop working in the district. I worked in the district before I went in the House, and I worked in the district when I was in the House. I worked in the district when I was out of the House. So because I'm committed.
You're a true public servant.
Yeah.
And we have too few of them, and we need you back in. So we're going to keep an eye on your district for sure. I know all the people in the GOP up there. I haven't been up there in a little while, but we're going to keep track of what you're doing and make sure that you get in. We can't have no Democrat come up there again. We can't do it.
And Frank, just know that if you need something from us, messaging, help, let us know.
Sure will. I appreciate that.
Well, it's important. We all win as one.
Absolutely.
Look, the sad thing, Vance County and Granville County can't afford to lose any time, but we've lost 2 years with the Democrat who is serving now. Well, actually, I use that word loosely. He's not serving.
Well, we'll make sure, but we've got to keep our supermajority. Otherwise, we're not going to go very far. And so this is a year, by the way, guys, that look, I'm just going to say this, where we're polling right now with Trump is the same place, actually just a little bit below where Obama was polling at his midterm year. and also I think where Bush was. Those were catastrophic midterms. That's what we're tracking at today.
Mm-hmm.
And, with Trump, we don't ever know what he's going to say. It could be right. So at a Davos, I noticed a little bit of difference and a little bit of improvement. A little bit. He finally owned the economy. He said, look, I never thought I would hear that, instead of, hey, what's the problem? What do you got? This is your illusion. So, but again, you are closer to the people, right, than the president. So you have an opportunity to message on these things. I'm telling you, we have a lot of candidates watching tonight. They watch all the time. The messaging from somebody is critical, because we don't know what Trump is going to say, right? I mean, we can't have, and so you have to remember too, as a voter, that Frank's position is much more important than Trump's position, right?
100%.
Because you're gonna make sure that the federal law, like ICE cooperation, et cetera, the DEI, you're gonna make sure that's overseen.
That's right.
Plus what we've seen this year out of our General Assembly, plus they're building on that federal legislation and closing loopholes and oversight. I'm very proud of what I've seen, in particular from the House. We need to keep it going, and that's why we need Frank to win. So, Frank, as we close, tell us where people can make a donation.
They can go to my website, frankfornc.com. They can, if they want to mail contribution, Committee to Elect Frank Sossaman, P.O. Box 435, Henderson, North Carolina, 27536. So you can do it online through the website, or you can mail it, whichever you prefer. Some people don't trust online giving. Yeah. Some do. So they
I know. I've had to drive over and get checks for people. So I definitely know. But this is a must win. We've got to get you in. We've got to keep the power. And thank you very much.
Thank you so much for having me. And I look forward to seeing you and being in touch with you.
Frank, it was good to meet you. I can't wait to talk to you more often.
Thank you.
Well, that was great. I mean, this is a must-win, guys. Again, I mean, you can see it was within 100 votes. I believe they did a recount. With Frank's race last time was the last one called.
Yeah, they had to do a recount in it. Yeah, absolutely.
So, so great. So we've got another special guest, and this is, let me get one more sip of my Skittle water, because it's got preservatives in there, and the doctor's not going to like it. So, we have a real leader with the MAHA movement. He's a longtime orthopedic surgeon. I called him today about my hip, actually. He lives in Laurenburg in Scotland County. Big MAHA guy. And one of my favorite things about you, Ralph, is you're very good friends with Huckabee. And he's one of my favorites.
Absolutely. And I guess he's the one that drugged me into this.
He's the one. Yeah, he's the one that drug you into this. And I think that's maybe you can't cuss at him, so you can give him some strong words if you don't like it.
No, I mean, he would use this pitch frequently to say, you got to get in the arena, the man in the arena, willing to fight. And that's part of the inspiration. So, I've been doing surgery for a lot of years. I don't want them to tell me I can't operate anymore, so I need to find a desk job in Raleigh. So, and this is what I feel like, quite frankly, is my calling. I'm tempted to move up to Sossaman's district because I sure would like to vote for him, but I think I got work to do in mine.
Well, I know he's great. I guess Margot's taking a little bit of a break. So we talked today. In fact, we talked pre-show because I know you off the show, and I actually called you about my hip, and I didn't like what you told me. But anyway, we talked about all the things that we could talk about tonight, which for us would be limitless, because, like Margot said, I've been in healthcare. We could, it's limitless. So I think that what voters are really concerned about are affordability. And we hear this a lot, having the supply of doctors. What we've heard is that sometimes people are waiting upwards of 2 and 3 months for specialists. And so when it comes to affordability, what are some of the things that can be done by the legislature?
Well, we got two problems there: access and affordability. Affordability, I think, could be best addressed by eliminating the CON laws. But affordability could also,
Tell me what those are.
certificate of need laws that still apply to most counties in North Carolina, which are basically restraint of trade, not allowing you to open an MRI or CT scanner or outpatient surgery center.
Okay, so if I'm an entrepreneur, right, and I say, okay, Scotland County and 9 other counties, they have to drive 30 minutes, 45 minutes to go to an MRI. So I, as an entrepreneur, I'm going to open my business because that's what entrepreneurs do, right? They fulfill needs. I'm going to open a business. What they need to do is get approval and red tape that a lot of times doesn't come. So that certificate of need, that's just an example of you guys where that could improve prices, right? Because there's more competition and access at the same time. So we need those con laws rescinded. Do you know where we are in getting that to happen in a General Assembly?
Well, yes, they've repealed CON laws for all counties that have a population less than 125,000. And I know of some counties that were right at that cusp. I think they wanted to do 100,000, but there were a couple of counties in that range that said, no, let's push it on up to 125, where the hospitals,
couldn't be lobbyists having anything
could
to do with
be,
that,
could be lobbyists for hospitals. Yes, it could be. But it's accessibility, like where I am, I came to Scotland County when it was a manufacturing and agricultural community. And I've watched the bipartisan assault where the oligarchy took all our jobs and sent them first to Latin America. And then they sent them to China and Vietnam and everywhere else. So now we're a poor county. And our neighbor, Hope County, which is part of my district, and I got to do this because nobody knows where I'm talking about.
Yeah.
This little blue blemish right here that's between Charlotte and the beach, it's the last blue district on the
So for those of you watching, the red is Republican. Can you hold that up again? That's a very nice visual because you can see and zoom it back a little bit towards you. So North Carolina counties, right? They're pretty much red. Now you have the tough job. Now we can see you. We're done with your map. But you have the tough job of being in between, right? You've got some in each county, but you told me too that when it comes to big hospital systems, we think about Novant, we think about Atrium, we think about Vidant here, right? But I've written about these nonprofit hospitals, and it's funny because I hear this all the time that I'm the female version of Dale Falwell, who was our.
Yeah, that's a good thing to be.
That I hear that a lot. And Dale, if you're listening, and actually I'm going to send him this. He usually calls while I'm on the show, but I hope you don't get offended, Dale. But not enough Republicans are talking about these big cheese, head honchos that make a tremendous amount of money while their hospitals are not giving out charity cases like they should. And they're making millions upon millions of dollars for themselves. What do you think?
I think that CEOs across the country in multiple industries are overcompensated, and certainly the CEOs in not-for-profit hospital systems are overcompensated, in my opinion. And I'm fortunate that our little hospital, our 100-bed hospital, which I think is the best 100-bed hospital in the country, is a private institution and answers to local board trustees who are my neighbors and who I've, fix my car and have local businesses. That's who they answer to. And that's who the CEO answers to. So there's a little bit more, when you have to look your patient in the eye, you have to look your customer in the eye. There's a little bit more accountability than there is if your CEO is in Milwaukee or Charlotte and running a hospital system that goes from Milwaukee to Macon, Georgia. So, and I've got a love-hate relationship with those guys because we deal with them all the time. They do help us in many ways, Atrium, but they don't own us, and I really appreciate that independence. But the accessibility issue to doctors and specialists is about doctors and specialists don't want to move to the country. Well, this is the country. And I can tell you, if we train more of them in the country, they'd want to be in the country because there's a lot of sanity out here. There's a lot of common sense. There's green grass. There's a big yard. your home can be on a couple acres instead of 20 feet from your neighbor's house. So that would be one thing I would try to do. But go ahead.
Well, here's the thing, and I wrote about this too. I just want to see what you think. To that end, okay, so Margot just texted in. She lost power where she is, and it's very cold there. So I want everybody to pray for Margot right now because she has no power at all, and her without her internet and stuff, you don't want to be near her. Anyway,
how far west is she, if you don't mind me asking?
6 hours from here. She's in Cherokee County, right out there.
Ooh. So, yeah, my wife's from the northwestern corner. She's in the southwestern corner. Yeah. Okay.
She's going to be frozen. So I will call her later. But having a place that Murphy. Now she's mad. She's in Murphy. I'm sorry. I keep saying Cherokee. Having a place that doctors want to retire to, right? Let's say a doctor, 5 kids, whatever, from New York, Mondani's there. They want to escape the end of the world. The one thing I like, we've talked about this, I'm going to try to be a good girl, that the House did was the interstate compact where theoretically a doctor could move here with less red tape. And we could get more doctors in rural areas, right?
I think that's a good thing to have reciprocity amongst the states. Not make it so difficult. You do want to make sure that the credentials are for real. That they didn't get their diploma from a Cracker Jack box. But yes, I think that's good. The interstate compact is a good thing.
Right. I think that is a good thing because in theory, right, we could become a retirement haven for, and I hate to say this, if you're a doctor and you are a Democrat, you can take your ass on to South Carolina or wherever. Please do not stop here. But if you are a Republican from Virginia and you need to escape, or you need to escape New York, right? We just made it a little bit easier to do that. And I think it'd be a good idea if we made the system better for that sort of thing. ECU, its stated purpose is to train rural doctors. They're number 1 in the country as far as training primary care and family care, which are 2 different things, guys, but they're either primary or family. But I've looked at the statistics and they move on. Not enough of them stay.
Yeah, that could be true.
Yeah.
Greenville is it's a medium-sized city, I guess, compared to where I'm living.
But they have them training all over. I mean, their stated purpose, their grants, etc., is to be that rural center. But you know what we could do? And too bad that Margot's on. She's listening, though. I'm going to hear her in my head. If we could take and make Western North Carolina also a medical school, because that would increase the supply, and everybody wants to live in the mountains. So that would be a great thing to bring professors.
Yeah, it's the West is particularly hurting. The Western counties, I know, particularly. Our little area is, and there's some other spots, but the West is tough.
So what can we do? I mean, we're being told by some that, in fact, Greg Murphy, so I'm just going to call it out. We've been told by him, and he paid a heavy price for saying this about a year ago, is that he was alluding to the fact that, being a doctor is something that Americans aren't willing to do anymore, to that effect. And that laid down the pretext for bringing in more foreign workers. Now, in Congress, of course, they set the amount of residency spots that we're allowed to have. So that's one idea on the federal front. But can the General Assembly work to either fund more residencies or have another medical school in Western North Carolina? What do you think?
I'm sure they could. I was surprised to read in the paper. I didn't even know it was happening. That there's a medical school, MD granting medical school coming to Methodist University in Fayetteville. Mm-hmm. And for me, that's close, relatively close. That's just out of my district, just out of Hope County into Cumberland County. So, I'm excited about that.
A lot of veterans.
Why couldn't they do that in the West too? They could easily do it in the West. I would think. Yeah.
And that would be great. That would be.
And I think, frankly, I hate to get into a big controversy here, but there's a proposal to build a children's hospital on the taxpayer dime in the Triangle.
Right near me.
I mean, I think Duke and UNC can probably afford that without the taxpayer. Maybe the taxpayer's money ought to go to the rural area in the west, or wherever it is, to help fund a medical school or nursing school or nurse practitioner training, PAs, whatever.
Well, I'm very close to the nurse practitioners, and they've got, I want to say, 7 training programs here. And so they crank out a healthy supply. And as you're well aware, PAs had expanded practice under that same bill, that same compact bill. And maybe it's time that nurse practitioners do too. I will, that's a hotly contested issue. I'll leave it up to the nurses to lobby for that. But again, that's another thing that spreads access, and it's lower cost. It's lower cost, guys, because PAs and nurse practitioners, they can only bill 85% of the cost. Right. So, you are lowering costs. I mean, I prefer, when I take my kids in, they go to a nurse practitioner. So that might be
my primary care, and my wife's primary care is a nurse practitioner.
Well, I'm going to let the nurses know about you then, because they will know that they're going to have another ally in Raleigh, which they definitely need.
Now, I got buddies that are specialists all over the place. I can call whoever I need, but yeah, that's we trust her completely. So I got to say this: that little poor district, and I talked to you about the economic destruction caused by the offshoring of our jobs to our little district and a lot of districts around the state. The number one thing that people in my district care about is that not necessarily the affordability of healthcare, but just the affordability of living. And we need good jobs and economic development and all that kind of stuff. And quite frankly, because we're blue, we get less of that funding. Interstate comes from Lumberton to Laurinburg. It stops Scotland County, big hole, no interstate. Then it picks back up in Richmond County. Both those counties are red. So it's crazy. And we need a corridor from here up by Fort Bragg into Fayetteville. It would be a natural connection, a good connection from 95 to get you to Charlotte, other than having to go 85.
Okay.
So there's a lot of ideas like that, and we're just overlooked because all the money and the power is in that crescent from Raleigh to Charlotte, and we need a little tap into some of that, bring it our way.
It's going to take mean.
And the other thing, healthcare.
To do that. It's going to take mean and belligerent reps to push for that inside their own party. Are you ready for that?
I don't know that I want that reputation. I will go first with my buddy Brian Echeveria's proposal. Let's do something about property taxes that impact the middle class and the retired people so much. So that's important. We need water down here. It's especially in Hope County. But let's get one more thing back to healthcare before we run out of time. The existential crisis for our nation is the health of our population and the health of our children. And that's what the MAHA thing is all about. And it's hard to get excited about broccoli instead of baked potato, but that's where we have to go. Mm-hmm. And so I'm all for the food pyramid being upside down.
I like that.
That's very, very
good for our protein farmers here. It's going to be a big boon for us. Yeah.
I read your piece on that too. Exactly right. That will help our farmers and get some of that local produce to the local school for lunch instead of having it sit on the shelf somewhere for months on end with a bunch of preservatives in it. So all that can happen. And when you reduce the burden of chronic disease and people are healthier and feel better, guess what? You don't need as many of me. You don't need as many doctors. And that would be an even better world. We're paying 3 or 4 times the average price for healthcare of most industrialized countries that live at our standard of living. And we have 5 years less life expectancy. And we have 5 times the obesity rate in children that they have in France. We have 77% of our military age kids cannot qualify medically to go in the service. How are we going to pull off another Venezuela or another Iran bombing? Whatever you think about the politics of doing that or not doing that, those were precision operations. Where are the people going to do that?
Security threat. Yeah. I have a friend of mine that was in Medellin for, the last 6 months. And he said that Columbia, yeah. And he went to, he said the healthcare there is incredible. I mean, if you have a decent amount of money, I guess, but it was incredible, top notch, whatever. And he just went to the ER. He stepped on a rusty nail. He goes, the environment in the healthcare system here is every man for themselves. Every man for themselves to get in. I mean, you've got to, it's like a rat race just to be treated. And I thought, wow, that's just such a demonstrable difference in,
Well,
you know?
absolutely. And I won't say it's like that and perfect and Marcus Welby and all that in Scotland County and in our district, but it has been quite a blessing to practice in a rural area where my kids are playing, ball with my patient's grandson or whatever. And so there's a real sense of community, and that really adds a lot. And again, when you take things bigger, make them bigger and bigger and bigger, they become less and less personal. And you got that CEO making 25 million that's running a big system, and he's just worrying about how many colonoscopies he can get done at this center next week. So
right, it's a numbers game. It's like and they're almost in the way that Obamacare, which has completely destroyed our healthcare system. Period. End of discussion. It's made us all like a number, and it's also made doctors utilitarian actors rather than true technicians and practitioners.
Right. I agree with that completely. And they want to make us a commodity because then, we can care less and we're expendable and we're replaceable. Okay, we'll fire that one, get another one.
For instance.
Yes. We're a long way from it being that bad. And again, I think it's been a tremendous blessing to do this work. And I want to go to Raleigh to fight for my district, get them the funding they need, and to fight for these principles. I sometimes talk about like internet service. You want download and you want upload. Well, the download is to bring things to my district, and the upload is what can I bring from my medical experience as a rural orthopedic surgeon for 36 years to Raleigh to, get some common sense things happening.
Well, you can get two things. When you're here, you can help me with my hip, number one. And number two is that, you're going to provide some backup. I've been very critical of the two doctors in the General Assembly because I think some things I would have done differently. But I think we need a balance there. I think we need another advocate for innovation in healthcare. I'm telling you, the Senate does not have anyone that really knows about healthcare. They know how to. They were trained by lobbyists. This is Sloan Ratcliffe talking. This isn't Ralph Carter. They were trained by lobbyists in the Senate, and they do what the lobbyists say. And they are so distant from patients, from rural patients, and they're so close to lobbyists. So we need people who have treated patients, who have walked the walk, who have, like Frank, served their community. We have a lot of that in the House. I see in the Senate, Sloan Ratcliffe talking here, that there's not a lot of that. And when it comes to healthcare, the lion's share of the healthcare stuff that has been passed has the fingerprints of the Senate. And so I'm hoping that we'll get a little bit more balance in the House. So I selfishly want you here.
Well, I think that this clash between the Senate and the House is particularly embarrassing. We don't have a budget, and I don't know all the details of how that works. And I'm not going to necessarily share your opinions about the doctors in the House now, but let's just say I think we need one more doctor in the House. So
I'm one that can fix my hip. I mean, let's be honest, okay? Because I got to keep working out. So
yeah, that's not going to happen in the basement of the General Assembly.
I'm flexible. I'll anywhere I can. Listen, healthcare in America, you got to do what you got to do. But anyway, well, thank you so much for coming on. Where can we find you? Where can we donate?
Thank you for having me. I'm on the internet, ralphcarterforhouse.com, I think is what it is.
Is it for like FOR?
For like a FOR.
Okay.
ralphcarterforhouse.com. Okay.
And we didn't even get to talk about, Huckabee. So we know that you're a great evangelical, need more of them. We know, obviously Frank is. And so we need a bit more clear and grounded leadership. Because when you are like that, you're resistant to lobbyists, right? You're resistant to special interests, and you're more guided by, right, fulfilling biblical principles, which work for everyone. I'm a Jew. They work for me. This is the foundation of society. We need more.
Yeah, we're grafted into that vine. That's exactly what we are. And I've been to Israel 3 times, all times with Huckabee. It's a long story, but the third time we were invited to come be their medical team, which was kind of fun. We didn't have any orthopedic injuries that trip, but one trip we did have a bunch of them. So that's really how we got to know Mike so well. We were taking care of all these patients that were falling down and breaking things. But it was
So you can roll your foot very easily in Israel.
Absolutely. And wait a minute, let me see what's in that. Is that sugar in the bottom?
Oh, I was not supposed. Listen, I wasn't supposed to cuss when Frank was on because he's a pastor, and I wasn't supposed to drink this when you were on. You're a doctor.
It doesn't look too bad. Was they got pomegranates or something in it?
No, it's actually Skittles. You know, the candy, but they make a flavored water packet. I know it's got all the colors in it.
Yeah. Okay.
Well,
somebody will be calling you tomorrow about that. No.
I'm gonna clean up my act. I'm gonna get myself together. I'm gonna stop cussing.
You're doing all this working out. You might as well eat right too. So
that's true. That's true. You know, a lot of people are on me about the way I eat. In fact, Mindy and Tara are good friends of ours. So we won't even go. But well, thank you very much. We've had a wonderful night. And guys, I want you to share this with 10 people because again, not enough people are hearing the truth. Not enough people are meeting our candidates. That's something that we have to do. We have to win this election. Otherwise, the Democrats are going to take control, and they are crazy.
That's a wrap on today's NC Political Tea. We hope you're leaving sharper, spicier, and ready to take on the political craziness in the Tar Heel State. If you loved what you heard, or even if it made you mad, don't forget to subscribe, leave a review, and share this show with your friends, family, and that one coworker who just needs the truth. Follow us on social media to stay in the loop and get your daily dose of conservative fire. And remember, here in North Carolina, the grassroots grows stronger when we stand together. Until next time, keep the faith, keep up the fight, and don't let the left water down your tea. This is NC Political Tea, where we spill it like it is.